With me are the Minister of Education, Youth and Information, the Honorable Fayval Williams, State Minister in the Ministry of Education, Youth and Information, the Honorable Robert Morgan, the Permanent Secretary Acting, Dr. Grace McLean, the Chief Education Officer Acting, Dr. Kasan Troupe, the Chief Executive Officer of the Child Protection and Family Services Agency, Mrs. Rosalee Gage-Grey. In virtual land, we have the regional directors and education officers, other partners in education, and of course, parents and students out there. We're all here to discuss the business of education. Thank you so much for joining. I will now hand over to the Minister of Education, who will give a few remarks, because this evening we really just want to hear from you. I know you have concerns. There are things of interest that might come up, and we want to hear what your questions are, what your apprehensions are, if any, so that we can allay all your fears. We know that you have been clamoring for so many things, and I am already anticipating some of the questions. I think I have a fair idea what some persons will be asking, but then there are persons who might throw me off. So we welcome all questions. We want you to feel free to, through our social media pages, send us the messages. We have persons who will feed us the questions, and we'll answer all your questions to the best of our ability. We know that parents are very important in education. It doesn't happen without you. And I want to use the opportunity then to just quickly say what the National Parenting Support Commission's mission is. And it's to assist parents in developing the skills they need to raise their children, and to encourage that collaborative effort between the home and school so that parents and teachers may cooperate intelligently in the education of children. So you are an important stakeholder group, and that is why we're here, to listen to you, to hear your concerns, and to listen to suggestions you might have. So, Minister, without further ado, the floor is yours.
Thank you very much. Good night, everyone. Let me acknowledge very quickly our Honorable Minister, Minister Robert Morgan, our Permanent Secretary, Dr. Grace McLean, our CEO, Chief Education Officer, Dr. Kasan Troupe, and of course, you just heard from Kaysia from the National Parenting Support Commission, and we have Ms. Gage-Grey from the CPFSA as well. So we have here, on the panel, all persons from the Ministry of Education, Youth and Information to listen to you this afternoon, to hear how you're feeling about the many approaches that we've had since school was declared open on October 5th. We want to hear from you about the experience you've been having with the online system. We also want to update you as well in terms of the pilot program we had to give us some information about returning to face-to-face. You would have known that 17 schools were in a pilot program for 2 weeks. We learned a lot from that, and we were able to use that information to continue the phased rollout of schools across Jamaica. Most recently, we would have indicated another 22 schools that are in operations right now until the end of the semester, December 18th. We're looking at others, maybe another 69 or so for January 4th when school reopens again. We'll also have information for you in terms of the PEP exams next year, CSEC and CAPE exams, and we will answer any questions you have about those as well. So this afternoon, the next hour and a half, is for you, our parents, to engage with us on topics of concern to you with regards to your child and our schools. Thank you very much.
Okay, so please ensure now that you're sending your questions through. We have persons who are monitoring the social media pages. Thank you so much, Minister, for your kind remarks, and we really want to get the questions coming in. We understand that some persons have concerns. We want to hear from you. So if you just feed me the questions, then I will answer them. I know that this is a difficult time, and I hear myself sounding almost redundant at this point, but it is a difficult time, and with difficult situations, we have difficult decisions that we have to make. We're saying that we want to ensure that as an important stakeholder group, you are aware of those decisions. You can ask your questions, but you can also make suggestions. We are here and we're doing the best we can, but we believe that the home-school relationship is important. So then parents, it's important that you send in your questions so that the ministers who are here and the technical team will be able to answer the questions you have. Yes.
Dr. Troupe to just say
Yes.
a little bit about the exams, looking for the dates and so on. Yes.
Okay. So while yes, thank you, Minister. While we're scoring the social media pages and sorting those questions through, thank you for those of you who are already typing. We're going to invite Dr. Troupe to just say a few words. That's a CEO who will say a few words about the upcoming exams.
Okay, thank you very much, Ms. Kerr. Good evening to our ministers, PS, and Mrs. Gage-Grey. Good evening to our listening audience. As you know, we would have sent out our bulletin to our schools, indicating to them that the Ministry of Education would have been listening. We have been consulting, and we share the concerns that our parents have about the adequate time to prepare our students for the hybrid exam and high-stake exam. And so the ministry would have taken the decision to reduce the content coverage for our primary exit profile. What that means is that we would have anticipated under normal circumstances that some units would have been covered in the curriculum. Each term has units to be covered and learning objectives to be met. But given the time that we have available, given that we are delayed the start of school, that would have compromised the amount of time we have available to make sure that our students are adequately prepared. And so our minister would have directed us to review the time that we have available, look at our diagnostic tools that we would have sent onto the system, what we learned from that, and you would have heard our minister talking about what we garnered from that information, and we would have anticipated this given the challenges that we are being faced with. And so we took the decision to reduce, so the students would now do unit term 1, all units of term 1, and for term 2, they will only do unit 1 for most of the areas concerning the curriculum-based test and for our performance task. We would have sent out the specific information in our bulletin, so our principals are fully aware, and we are using this medium to say to our principals, ensure that you communicate effectively with our parents. We want our parents to be fully aware of what the system is doing, how we are adjusting to make sure that our boys and girls can perform at this critical time. So we will have for the abilities test, that sitting will be in February 23rd to be exact, and we want our boys and girls to get ready. So with the modalities that we have available, parents, we want you to maximize those opportunities. Remember, we have the e-home school network, fully developed televised program that is focused on the PEP, and that is delivered every day. We send out to the system a schedule guiding how the lessons will be delivered, the topics, everything is available, and we have shared that in our social media pages and with the traditional media, and we have shared it to our schools. And I know from the reports we have got from our principals that you have been updated in your WhatsApp groups and so I want you to pay keen attention to that. We have also shifted the dates for a delayed sitting for the exam. So we have moved it by a month. So the curriculum-based test will be later down. We would have it in April. Now we are going to have that in May 25th and 26th, right? And of course, the PT, which is the performance task, we are now going to have that in April, which is April 22nd and 23rd. So parents, please make note of that. And that, again, is a 1-month delay time, in addition to the fact that we are reducing the content that the children are expected to cover within the period that we have available. So those are some of the changes that we have made for the PEP exam. For CXE, we are fully aware that we are having conversations and consultations with CXE on the modified approach, possibly, that will be administered this year. CXE has explained from their own analysis that the preference right now is for them to go back to the usual form of the exam, which is their paper 1 and paper 2, and the SBA, and they would have indicated that they would prefer to moderate the SBA's 100% this year. Now, our principals would have explained some concerns about that, and we are dialoguing CSEC now to make a decision going forward.
Thank you, Dr. Troupe, and thank you to those parents who have already sent in questions. We only have an hour and a half, so we're going to jump right into the questions. We want to ensure we get as many of them answered as possible. So the first question is, what is the protocol for the reopening of school next month? I'm reading what I see.
Well,
yes.
We would have looked at, we would have used the pilot program to help us to understand everything about the school, to give us the confidence to reopen schools. So we would have used a risk-based approach to look at a number of different factors. On top of that, we would have had consultation with the principals, the teachers on the ground to help to guide us, because we wanted to make sure that we don't just say the school is open, but that the principals, students, the parents are ready for those schools to be opened. And so that was what happened in the 2 weeks of the pilot for those 17 schools. We were able to do our assessment, to do interviews of students and parents to hear their concerns. What are they most fearful of? Were they aware of the protocols and so on? It gave us useful information that we're now using to guide the next round of schools that can come back face to face. An important factor in all of this is the physical inspection that the Ministry of Health and Wellness does of the school compound, looking at all the COVID protocol measures that are supposed to be in place to ensure that they are in place. So for example, it will be looking for wash stations, for the markers in the corridor, for isolation rooms that can be used to manage cases of a child coming to school with symptoms and so on. So we looked at a number of different factors to help to guide our decision as to which schools we can phase back in, because we know that it would not be wise to have all our schools all at once coming back to the face-to-face. And so we believe in this method of bringing schools back over time in a phased way, in an orderly way. It would allow us to ensure that the resources that the schools need, that it is available to them. It also gives increased confidence to our parents, to our students, that we are being deliberate and we're managing in a sound way to ensure safety of our students.
Thank you, Minister, for that comprehensive response. So parents, you would have heard that the Ministry of Health was consulted and they did their own assessments. And I want to thank you, Minister, for clarifying further that not every school is going to go back face-to-face. And I think a conversation I had this morning, there was that suggestion. So it's a number of schools, 125. Is that the number?
Right, that were deemed
fit,
low risk.
Right, or
but
low
of
risk.
that, a subset of that
Okay.
will be going back
right.
come January. But as the days and weeks go by, we continue to look at the information, to assess the information, because as you can imagine, a school that is in one state today can become significantly improved in a week, and so that school would get added and so on. So a phased basis means some schools today, some tomorrow, and so on.
Okay, thank you, Minister. On what basis is a school ready for reopening? I think we just answered that question. So we move to the third. Should I be returning the tablet to the school? The school made me sign an agreement for it to be returned. So we'll have the permanent secretary answer that one.
Okay, honorable ministers and other members of the team, and good evening to all our parents who are out there tuning in to this very important town hall meeting. So we are aware, for accountability purposes, that your principals would have provided you with a document for you to sign, which would suggest that you have received a tablet or a laptop and you will be using it during a particular period. I must say that initially our intention was to provide these instruments to you for you to use within the school term, and for these to be returned at the end of the school term for us to do whatever refreshing and the addition of additional content as you move to another grade and so on. So that was the initial arrangement that we had in place, and that's the documentation that we sent to the school. However, after consultation and discussion with our minister, we are now looking at a different approach, an approach which will not only allow for you to utilize these instruments during the school year, but for you to also have these instruments to use during the holiday. Not accounting for all our students. And so we now have to take education to the communities. So we are partnering with our community development partners, our satellite areas in our communities, our learning spaces, what we call temporary learning spaces, and access point centers in our communities with USF and churches. We are identifying those centers and those areas that students can gather in a safe way. We are separating and grouping the students who we have identified at level 1, 2, 3, and 4, and we will be working with these students in groups of 5. We will be assigning teacher assistant to these students, and I'm proud our state minister would have indicated to us some time ago, let us capitalize on our tertiary students who are completing their community service. Our teachers' colleges would have indicated to us the availability of our student teachers to assist in this regard. And we are going to be utilizing that skill set or those skill sets to help our students with the support of their assigned teachers. So we will be in the communities. Twice per week, these students will be met with in small groups. We have developed the materials for these students already, and we will be working. Our curriculum unit also will be doing some work. They have developed two approaches thus far, which is called, we're maximizing again on the learning kits. And one thing that we have learned, parents, is that during this time, it's not about recreating, it's about maximizing on the resources that you now have. So the learning kits that we have available in the system through our partners, we are going to be looking back at that. And again, developing the responsive instructional activities to address the levels. And we are going to be working with these students with the learning kits. There is one category called the Challenger to manage progress, and one called the Motivator to look at exploration and development. The Challenger will look at the gaps that we have identified, and the Motivator kit will be looking at the new learning objectives and the ones to come. So those are some of the activities that we have in place. We are also partnering with consultants, those educational partners in the system who provide support services for PEP. We are going to be consulting with those and providing that fully funded access to those resources in the virtual space for our boys and girls to be able to practice for the exam, to be exposed and enriched by the materials that are already approved by our curriculum unit. They are aligned to the curriculum, and they will now become available to all our boys and girls at the government's expense. So those are some of the activities that we have in place, and much more to come as it relates to monitoring, utilizing the curriculum implementation team, being in the space, conversing with parents, and utilizing the platforms to develop our teachers in the common planning time so they can develop the responsive services for our boys and girls. So those are some of the activities.
Thank you, Dr. Troupe. In my haste to get to the questions, I remissed in introducing myself. Neither did I say hello to the media. I'm Kaysia Kerr, CEO of the National Parenting Support Commission, and to all the persons out there from the media, we welcome you as well. Dr. Troupe and parents, I know after these sessions you generally call to say you didn't hear your question. So as best as possible, I'll read what you have, but sometimes I have to correct a little bit. I know you're writing hastily and you might make errors. So I'm reading all your questions, rest assured. So this question as is says, when will be the grade 4 exam and will their exam be reduced? So I'll rephrase, when will the grade 4 exam be administered? And will the exam be modified?
Yes, I think we said that a little earlier, that the grade 4 will be administered in June, the latter part of June. And yes, it will be modified. We will reduce the content coverage. So you will only be assessed, the boys and girls will only be assessed on what they will cover for this term and what they will cover for the first unit in the second term. And then we will focus on refreshing, dealing with the gaps, and getting them prepared for the latter part of the term, which is June, to have the sitting of those exams, which is the performance task.
Thank you. And is there any primary school on the list for the reopening in January?
Yes, I'm not remembering the exact names now, but we have a number of primary and high schools that are on the list. In fact, for the pilot that we did, we had 14 primary schools and 3 high schools. And in this set that we have operating now, we have 4 primary schools and 18 high schools. And for the next set to come, we do have a breakdown.
Yes, go ahead.
Of the 22 schools that would have started on Monday. Right, or Bloomfield Primary, or Arcabessa High, Seaford High, Seaside Primary, Albertown High, Ferncourt High, Troy High, Karen Current Primary, Frome Technical High, Maud McLeod High, Rhodes Hall High, Aberdeen High, Black River High, Mile Gully High, Newell High, Park Mountain Primary, St. Elizabeth Technical High, Innswood High, Bustamante High, Central High, Clarendon College, Claude McKay High, plus Camperdown High that started yesterday.
And might I add, parents, if it is that your school will be open in January, you will hear from your principal long before that. It is not going to be a sudden move. We are doing a series of consultations, and then the principals are directed to do consultations with their staff and with their parents before any decision is taken. So you will be informed.
And I doubt those consultations will be void of parent input as well. So I think it's important to know that we're also listening to the parents as well. So you are part of that. Yes, Minister.
That, we decided to make this information known publicly early so that as you go through the Christmas, parents, you don't spend off all the money. So we want you to know ahead of time. We don't want you to get in January and said, oh my gosh, I didn't know. So that's why we're coming out. We're alerting our students to begin to focus on that very important exam, the PEP, but also our high school students in terms of their CSEC, and then our grade sixers in terms of the CAPE exams. I'm sorry, not grade sixers, sixth form or sixth formers.
Okay, thank you, Minister, and thank you, Dr. Troupe. Will independent schools be reopening the same time as public schools?
I'm going to ask Dr. McLean to take that because we've had that question so many times and the answer is the same all the time.
So thank you, Minister. So our independent schools, just to ensure that we are clear, they are in partnership with the ministry. They operate, they generally take control of their overall operations, except that they follow our curriculum and, of course, all the other technical activities relating to education in the country. There are some independent schools that are in partnership with the ministry, maybe about 150 of them, who we do place students who are our special needs students, as well as other students, especially at the secondary level. Now, as we indicated earlier, all schools that are to be reopened must be inspected and given clearance from the Ministry of Health in writing. We have communicated this to our independent schools, and so they may contact the Ministry of Health, does the inspection. Once they have their inspection report, then they can now go ahead in consultation with their parents and they can open. We have realized in our discussion with over 320 of those schools that there are different approaches. For example, we have been advised and we have seen it where our special needs students really do not do very well as it relates to virtual learning. And so the approach that they use is to ensure that the students come in small numbers and they go through whatever is required and they have this scheduled over a continuous period of time. There are others who are offering a boarding facility, and there are others who have different approaches that they are currently using. What we have said is just to ensure that in accordance with the independent schools regulations, which outlines the areas that are expected to be followed, including ensuring that you have a safe learning environment, and at this time it is the Disaster Risk Management Act and the protocols that are outlined. And of course, once you have your clean inspection report in writing, then you are free to go ahead and open.
Thank you, PS. I'm going to read this verbatim because this is just one of the best questions I've seen so far. I'm asking if Ali Infant School can get some assistance with Wi-Fi, for the school is very stressing for the teachers. Thank you. So here's a parent who has a teacher's interest at heart. Wonderful. Ali Infant. Yes, PS?
Is it here for Minister Margaret?
Southeast Clarendon, close to Rocky Point. So we have been rolling out internet through various facilities. Ready TV is one. We're partnering with other telecommunications companies. What we will have to do, though, is we'll have to further look at other schools, such as infant schools. We've been focusing a lot on primary and high schools over the last couple months, as we recognize that with the issues of PEP and the issues of CXC and CAPE, that those schools were in an urgent situation based on the current COVID pandemic. So what we're going to have to do at the ministry is start looking at some infant schools, which are actually government-run schools, to see how we can assist them. But other than that, do remember that a lot of the resources for access to education are zero-rated. So to use the Google Suite, you do not have to pay. So even though you may not have Wi-Fi at your school, if you have a data plan balance, remind me, CEO, of $500, you can access the Google Suite without using any of that. So what we've tried to do is to ensure that where persons do not have data on their devices, they still can access the education material through partnership with Flow, through partnerships with Digital as well.
Let me add that the goal of this government is to ensure that all our children across Jamaica, regardless of where they are, regardless of their socioeconomic standing, that they all have a device, a learning device, to help to accelerate what they know, to enrich the learning that they're doing. And, but it's going to take time. We've gotten a far way already in terms of the government's own procurements and in terms of the efforts of companies all across Jamaica who've stepped forward, or diaspora, or international partners that have come on board, and we're going to continue the rollout of devices, whether it be tablets or laptops in our high schools. That is an initiative that will continue until we get to that goal over time.
Thank you. Thank you, Minister. Who will be engaging parents and children on the results of the assessments that were done in October? Dr. Troupe? The results of the assessments done in October, who will be engaging the parents in that regard?
The diagnostic? Yes. Okay, so the data from the diagnostic test are available at the school level. And so all our teachers and principals will be engaging our principals in discussion, because the approach or the pathway that is going to be created for that child or for the children will have to be communicated, because we will need our parents' support, especially in light of the activities that we will roll out from Central to support our schools. So our parents will definitely have to be informed and engaged in that, because students are now going to be engaged at local spaces within their communities. So our parents, please be assured that your teachers and principals will engage you. The data should have been shared with you. If not yet, it will be shared with you. And the pathway that we have created for your child, and how the ministry, the external stakeholders to the schools, that is our education officers and our consultants, how they will be supporting that pathway that has been created for your child. So it is a three-pronged approach. It's home, state, and school working together to make sure that our children can be successful.
So this question hinges on that. Who will be engaging parents, and what will happen to those students left behind? And I think you just answered that on a school level, parents, you really need to also ensure that you're advocating. So if you have noticed that your child's attainment levels have fallen, or you think there were gaps prior, you need to also speak to the teachers. You can advocate. And of course, teachers who have been trained, they understand what it is when children have gaps. They know what that looks like. They would have been doing ongoing assessments, and they're fully equipped to treat with those situations. But it's important for you to have those conversations at the localized level. So each parent will talk to the school that his or her child attends. Okay, and we're moving on nicely. Is the tablet for the students on path, okay, are the tablets for the students on path to be returned to the school? So are tablets to be returned to the school?
So I responded to that a little earlier, but parents, I do understand the anxieties that you are having. And the fact is, tablets are now premium, as it appears as if this is the most effective channel through which our or your children can be educated. So as I indicated before, the tablets are for your children to use at this time. We must ensure that there is accountability, and hence you would have signed up documents with the schools. This is very important because what we also have to do is to ensure that we have the information in a database so as to prevent any duplication. We want all our students across the length and breadth of Jamaica to at least have a tablet a tablet or a laptop. And in order for us to be able to do this effectively, we must know those who have received so that we can provide those who need, and we can have a clean database as to the provision. And so the forms are very important, parents, for you to complete and to sign that your child has received a tablet. As I indicated before, we initially sent the correspondence to the schools to say that the tablets would be returned at the end of the school year. We are currently reviewing that process. We have already had discussion with our ministers, and we are now advancing the process to make sure that all the approvals are in place. Importantly, for those who will be leaving the school system, it means that you will be leaving with your tablet or your laptop, and hence those will have to be replaced for the next cohort that is moving ahead. So we have to make sure that we do the costing and we have the necessary approvals so that you can move along with your tablet, and the others who are coming in can also be provided with a tablet to continue their education. So parents, just to encourage you, let us focus now on your children utilizing the tablets with the apps that are included and the content so as to access learning and to make up the learning loss. And as soon as we have sorted out the full administrative details, then we will provide the schools with the information and you will be advised accordingly.
Thank you. Thank you, Pierce. What has been the experience in the pilot schools in terms of the level of spread of COVID-19 among the students?
Well, we have not had any spread of COVID-19 among any student, teacher, or administrator at any of our pilot schools. I think that there was a story a couple days ago that spoke not of the pilot schools, but of the incidence of COVID among school-aged children between March and currently. So far, we've had about 800 school-aged children over the period between March and now who have had COVID. What we have done is we have been very careful in how we administer the pilots, strict adherence to protocols in terms of hand washing, in terms of social distancing, in terms of wearing of masks, and so on, in terms of even the amount of students who are allowed on the compound. Before that, you would have had, the school would have had the benefit of at least 2 inspections by the Ministry of Health, parish health authorities. And the only way they could open is if the parish health authorities, which is governed by the Ministry of Health, would have approved them to be opened. So we're very happy with how the schools have accepted the protocols and the whole collaboration between board chairpersons, teachers, parents, who have all come together to work. I mean, we saw pictures of board chairmen at schools on the morning of the pilot, working to help schools to participate and to be successful. And that has become a template where other schools now can look at what has happened, can look at the challenges that were faced, because it wasn't perfect, there were challenges, and then can apply those best practices to their institutions as well, which is why we're now here, being able to open more schools for face-to-face. But while we're opening more schools, the protocols will still remain stringent, as we cannot afford to have any incidents of COVID taking over any of our pilot schools or any of the schools coming forward. And even if we do have an incident that obviously emanates from outside of the walls of the school, the protocols are established as to what to do if you suspect a student or somebody on staff may have COVID-like symptoms or flu-like symptoms. So we have not had any incidents, And thank God, we hope we never have any.
But is it safe to say this is testament to the fact that the protocols do work? And so this encourages a wider public to adhere to the protocols that have been communicated widely in media.
I think every incident, well, most incidents that we have become aware of publicly of COVID is where there has been a lack of adherence to the protocols. Whether it is lack of social distancing, whether it is lack of wearing masks, whether it is where someone who has been demonstrating symptoms has gone and participated in an event where there's a crowd, and that has caused a spread. So our administrators know, our principals know, the ministry knows that if we adhere strictly to the protocols outlined, not just by the Ministry of Health, but internationally accepted, then we will protect our children, our staff, and our parents and grandparents who are at home from a COVID incident. So that is our focus. That is what we keep preaching every day. Follow the protocols, adhere to the mask wearing, sanitization, social distancing, consistent hand washing, isolation of persons who may be suspected of having COVID. And that has worked for us, and we think it will continue to work.
Thank you. Yes, yes.
Additionally, we did a survey of the students to see their awareness of the COVID protocols, and a high percentage of them were aware. They were able to tell us that in the transportation that they used to school, whether or not persons were observing, wearing their mask and so forth, they knew what a mask break is, and they felt it was adequate at school. They were reported that they were constantly reminded about the protocols. So there's high level of awareness among the students, and you could see the interaction with the students and the teachers in terms of reinforcing each other and on the protocols.
So this also tells me that, when we model the right behaviors for children, they fall in line very readily. And I'm just so happy, like everybody else, that we've had no incident. And we want to ensure that our children will remain safe. So that's a template maybe for us as a society in general. Wear the mask, social distance, sanitize, and pray. Yes. All right. Here we go again. There was a question here about transportation. As you spoke to that, Minister, when will there be a transportation system in place?
Well, for our primary and high schools, the public primary and high schools, transportation is important because that's how the majority of our students get to school, especially in the corporate area. When we looked at the numbers in rural parts of Jamaica, less of our children took public transportation. I know right now at the ministry and the PS, I'll ask the PS to speak to that as well. We are in consultation with the transport providers to see how best we can organize transportation targeted for our students so that there is some higher degree of control in how our students come to school and how they get back home. But I'll ask the PS, because she's been involved in these meetings, to shed a little bit more light on that.
Okay, thank you, Minister. So parents, we are working closely with the Ministry of Transport and Mining, the Transport Authority, as well as the JUTC in terms of ensuring that there is adequate provision for our students in the areas that the JUTC operates, as well as the Montego Bay Metro. Now, as it relates to the Kingston metropolitan area, we provided the JUTC with the number of students for the schools that have been approved for opening. They were able to advise us that for 6 of the schools within this area, they are on the bus route, and they agreed that they would have included more buses on that route for the transportation of our students. And so we are really observing to see how that will go within the course of this week as well as the next 2 weeks. Now, there is a route for the JUTC from, I think it is Yalos, or 11 miles to Harborview, that they are willing to activate to support our students as well. And so we are in further discussion to have that completed. We are also in discussion under the Ministry's Rural Transportation Program that we started about 2 years ago to reactivate the route between Old Harbor and Clarendon for those students who apply those routes. So those discussions we have found to be very fruitful, and we are expecting that we will be able to provide the schools with further information later on. Now, as it relates to the rural transportation system, the ministry does have a budget for over 250 schools to accommodate about 7,500 of our students. As we speak, the team has started to organize meetings with bus contractors, I should call them, for example, Juto and others who may have additional capacity at this time. And so our plan is to have a discussion with these operators of service for transportation, and to see how best they can work with those schools that have been approved for reopening for the transportation of our students. We are also doing the same thing with the Taxis Association, and all those meetings are expected to be held within the course of this week. Now, the program is already structured, already approved. It is a decentralized program. So once we have decided on the number of students from a school, then the school enters into the contractual arrangement with the relevant contractor, and the payments and so on are handled at the local level. This has worked really well in the past. It has started for a few of the schools that have reopened, and we expect that this is going to be increasing. In addition to this, we are currently finalizing the transportation protocols, which of course guided by the Ministry of Health protocols, but specifically speaking to the transportation of our students. And this will be available by early next week, where we'll provide this to our schools, and we will also ensure that the bus operators, they have this information as well. The Transport Authority has also committed to provide additional inspectors across the country to ensure that the protocols are being followed, our students are being facilitated as best as possible, and just to maintain general order as we go through this phased reopening. So I must say that we are really advancing as it relates to just providing the support where we can. And I should also add that a number of our schools, especially our high schools, they do have school buses, and these are currently being utilized as well in terms of transporting the students. And some schools have already gone ahead and have established other arrangements. So our role at the Central Ministry is to ensure that there's a protocol document for transportation, the students are being monitored, and the rules are being observed as they go onto the buses. I think too, we also will have to synchronize the time that the students will go to the different schools. So the peak hour between, let's say, 6 o'clock and 9 o'clock, there may be some shifting just to make sure that they can manage the load in an adequate way. So we continue to have that discussion as well to ensure that our children remain safe. So it has been perhaps the last leg of the development of an aspect to support the phased reopening of schools, but I must say the discussion is going very, very well, and we expect that by January, when more schools are out, we would be able to transport as many of our students as possible through the JUTC as well as through the private contractors arrangements that we will have in place fully by then.
Thank you, PS. Yes, Minister.
On to other questions, I'd love to bring in Ms. Gage-Grey to just talk about the CPFSA and the resources that are available to parents through that agency.
Thank you, Minister. So certainly we have the CEO of the CPFSA here, and we're going to just have her say a few words to update all the parents as well.
Good evening, Ministers, PS, CEO, Ms. Kerr from the National Parenting Support Commission. So the Child Protection and Family Services Agency have primary responsibilities for children who are deemed to be in need of care and protection. So these are children who have been abused, abandoned, neglected, or otherwise at risk. And we partner with our stakeholders, and our schools are a major part of our stakeholder group. We work primarily with our guidance counselors and principals within the different schools. Since the school has been online, our efforts have been to work in communities to give support through the reports that we would have received through the National Children's Registry, or others who would have come into our 14 parish offices across the island, and we would have provided support for the children there. We have observed through the reports that we have been receiving that there are a lot of children who are experiencing psychosocial issues as a result of the fear they have of COVID, or the fact that they are not in the public space going to school. So we are quite pleased with the reopening. Schools are, as churches, are a major socializing agent for most of our children, and so this opportunity to get them to go back into the space to interface is very critical. We will continue to do the support. We have tasked our officers on the ground to be in touch with the guidance counselors at the schools that have been reopened, and we'll get the list of those to be opened, and we will continue to provide the support there. We want to encourage our parents to be vigilant as the children go back out using public transportation, going back to school, that they be very alert, that we know the schools have prepared for them, but we are asking that each child be given a little bottle of sanitizer and things that they can use whilst they are transiting through the community to go to school. So we are quite on board, and we'll continue to support, and we're asking our parents to make contact with us should they have any difficulties. Specifically for the children in state care, we have approximately 4,500 children in state care across our programs, foster care in our residential facilities. Some we supervise in their own homes through the courts. And so we have, since COVID in March, been providing additional support, thanks to the PS and the team who have led additional support to us so that we could lend support to the children that we have in state care, and we'll continue to do that over the period going through.
Thank you. Thank you, Mrs. Gage-Grey. There's a suggestion here from a parent that the Minister of Health should be here. We take that suggestion, but just to say that we don't make a move without consulting with the Ministry of Health. We have to ensure that the safety of our children remain paramount. So you can be assured that we're observing all the protocols, we're listening to them as the experts, and we're taking everything on the, not just considered, we're implementing everything they would have said that we're to implement. So thank you for that suggestion. But I think it's important to also say that we're following the strict guidelines of the Ministry of Health and Wellness. Moving right along, we're now sprinting, believe it or not. We only have half an hour to go. So we're going to move very quickly. We're going to try to get as many of your questions answered. So good night. Good night to you too. For the primary schools not scheduled for the reopening in January 2021, will the grade 6 students go back before the first exam in February?
Our intention, parents, is really to have our boys and girls in school. Our minister would have directed us to look at the exam students specifically, and so we would have pulled all those schools, those 125 schools that minister told you about earlier. We also looked at a special provision for our students who are being prepared for PEP and for CXC, and an approach is being worked out. The Ministry of Health for the high schools would have been given the list for all our 171 high schools, and they are looking at that. We are taking a similar approach for our primary schools. For all those primary schools that are already approved, it does not mean that all the students will be in. Our principals would have indicated to us that the grade 6 students, grade 4 to 6 in particularly, those are the priority age groups that they are focusing on for the face-to-face instructions. So yes, there's priority for them. But most importantly, we are not able to take a decision that is going to compromise the safety and health and well-being of our students. So whilst we really want everybody to be engaged face-to-face, if it is not possible, we will not be able to take that directive because we are working with the Ministry of Health and we take our guidance from them. But if it is possible, once we are guided and we are clear with where we have the protocols observed and it is safe and so, those students will be given priority. You can rest assured. If it is that they are not in the face-to-face, we are going to be focusing on them for the enrichment and the remedial activities that we are going to roll out in January.
Thank you, Chief Education Officer, Dr. Kasan Troupe. And Minister Morgan, I'm not sure if this is one of your constituents, but will Crooked River Primary in Clarendon be opened? And what about the infant schools? Will they be opened as well?
Sadly, Crooked River is not in my constituency. It is in, I think it is in northern Clarendon, I'm not sure, but it's above. The criteria for opening schools is based on the risk ranking approach, also consultation with the Ministry of Health, also inspection. So what I've said to my principals in my constituency is, find out from the health inspectors what it is that you need to do in order to bring your school up to the level where it can be opened. And then we can approach the Ministry of Education to see if there's any assistance your school can get, whether it is that you need more sanitizer stations, whether it is that you need guidance on how to set up an isolation section. So the schools, we're asking them is, what we're asking the schools to do is to work with your health department, invite them in, have them do their inspections, have them give you the recommendations as to what can be done so that your school can be opened. And then we, as the ministry now, have an opportunity to work with you based on the recommendations that have been made by the health authorities to see how best, if you are in that category with the potential to be opened, how best we can work with you to get you open. As it relates to, what was the question regarding infant schools? Basic schools?
Yes, I might have passed it, I can't
One
see.
of the things that we've been doing is that we've been working very closely with the Early Childhood Commission. I had a meeting with them recently where I inquired as to how many of these schools have been inspected, how many of them can be opened, what are the challenges related to them being opened. That is something that we're working on as it relates to basic schools. As you know, basic schools are pretty much private institutions which are governed in a different way from infant schools, which are government-run institutions. So the rules as to their engagement. But what is clear is that basic schools, if they fulfill the criteria, can open. But they have to fulfill the Ministry of Health criteria. And once they fulfill the Ministry of Health criteria, they can open, they can bring back the kids to school. There are several basic schools and several prep schools across the island which have already opened and are accepting students. But you have to fulfill the Ministry of Health criteria. That's basically it. And I think there's a bigger point here that we need to mention, and it's the fact that us as Jamaicans, us as a society, we are the ones who control whether we go back to face-to-face or not. The more COVID you have in the society, the less face-to-face you're going to have. If we do not follow the protocols, if we keep breaking the rules and COVID continues to increase, more parents are going to be challenged and frustrated by having to stay home and help to educate their children.
Can't have your cake and eat it
We
too.
want our children back in school, but we need the cooperation of the community, the parents, and the wider society to understand that if COVID is still a great risk in the community and in the society, it prevents us from opening more schools to 100% face-to-face.
Absolutely. So you've heard from Minister Morgan. We all have a responsibility in all of this. We have to make sure we're following all the protocols so that our children can return safely to school. Much is dependent on how responsibly we behave, not just today, but going forward. Thank you, Minister. Gavil High Primary. No, that's not right. I really do need glasses. Gavil Hill Primary is a small multigrade school that has prepared for the reopening. However, we're not on the list. The area has limited internet access, hence more than half of the student population is not catered for. Can some consideration be given?
No, I was going to say that, or the first, I guess the first thing that pops into my mind is what's the state of the Ministry of Health and Wellness's inspection. That is what we would need to know, because many times the Ministry of Health would inspect a school, they would leave a report with the principal that says, here are some of the gaps that you have, and unless action is taken to ensure that those gaps are filled and the Ministry of Health is called back, then the school is going to remain in a state not knowing if they're coming or going. So that calls for communication between the principals, their regional heads, or education officers to say, you know, the Ministry of Health has come to see us, because even though there's direct communication between Central Ministry and Ministry of Health, sometimes because of the time lag, the information doesn't flow as quickly as you would like it. So if the Ministry of Health has visited your school and they've left your report and it does not say satisfactory on it, please get in touch with your education officer, who will get in touch with the regional heads and the ministry and so on, so that we can get that going in terms of the conversation and understanding what are the elements about the inspection that the Ministry of Health and Wellness had a concern with, and then the Ministry of Education can take the action to help the schools to close the gap.
Minister, I just want to say to our parents that the schools, I want us to be clear that there is no school that has been given permission to reopen that was placed on the lists directly. The risk ranking has worked. It was introduced by our ministers. It has worked very well, coupled with the consultations on the ground, but there is no school that has usurped this process and has been given approval to open. And we have to ensure that we follow this procedure. It may coincide. You may want to open and you have been agitating to open, and you are a part of the low-risk schools and you have met all the criteria, so that's fine. But I think there's a notion that there are some schools that may have been considered as favorites and given the approval. I want to assure our parents that that is not so. We have followed the procedure slavishly, and we will continue to do so because it is about the safety of all our children.
Thank you, PS. And with that said, Minister Morgan, you had said something that resonated. So even with this question, maybe you'd want to reiterate that one sentence. With Christmas being such a busy time, will it be the safest move to have students going into school in January right after the busy season?
It's a simple decision.
Yes, absolutely.
You can get COVID in December and have a bad New Year. Or you can sacrifice gathering, sacrifice the party, and sacrifice all of that in order to invest in a good New Year, so that more of our kids can go to school, so we can have a more normalized economy, so that more tourists can come to our hotels, so we can earn more foreign exchange, so we can start rebuilding the economy stronger. It's a decision that every single Jamaican has to make in your own personal actions. Do you wear a mask or you don't wear a mask? Do you sanitize or you don't sanitize? Those decisions will influence. And COVID is a very interesting thing. You know, it's a disease where one individual can have such a great impact on the whole country, where one individual can infect hundreds by extension. One individual can cause an entire school system to shut down. So we as citizens have to focus on following the protocols. Yes, it's Christmas, but we can live to see many more Christmases if we just sacrifice this one time.
Minister Morgan is not one for euphemisms. You're either going to have what did you say? Because I like the ring of it. What did he say again? It had a ring, didn't it? Had a bad, right? A good Christmas and a bad New Year. Or you can sacrifice some of the things that you would have normally done, because we're not operating in normal times, are we? And then ensure that our children and teachers and all of us are safe for the new year. Sounds a little caustic, but hey, sometimes you need to just say it as it is. And I think there is absolutely a space. I'm very appreciative of when you just say it as it is.
No, but I don't.
Yes.
I'm sorry, I don't think it is. It's not caustic, it's the truth.
Yes, Minister.
The reality is that we have had in our society, in our country, a lot of persons above a particular age who have died because of COVID.
Yeah.
We've had young children who have died because of COVID. We have lost persons that we know because of COVID. I don't think there is a more serious, I wish there was a more serious way of communicating to the society that this is not a joke.
I think you just did so
if you
many
do
stuff.
not follow
Yes.
the protocols, people are going to die.
Yes. Yes.
And our schools will not be open. And the reason why we are passionate about it at the Ministry of Health is because we know that the most effective way to educate children is through face-to-face interaction. And schools are not just about teaching and learning. Schools are about building social development. The psychological impact that is being had by children who are not in school is going to last for a very long time. And we as ministers and technocrats and the public are going to have to pay for the consequences of it. So if our society does not recognize the risks that are associated with not doing what is necessary to win the fight against COVID, we are going to have to pay the cost in the years to come.
Yes, Minister.
To say that even though we have indicated the number of schools that we're anticipating will be opened on January 4th, it's all conditioned on what happens during the Christmas in terms of the numbers that the Ministry of Health and Wellness would report for COVID. So it's up to us, all of us, to make that sacrifice to ensure that our schools can open on January 4th.
Yes. Thank you. Thank you both for that, for those important words. We all must be very responsible, and much of what happens in January depends on how we behave during this season. Very important. Thank you for that, Minister. So now we move to another question. You mostly talk about the primary and high school, but what about the basic and infant? I think we've been talking about those. Okay, so we'll move on. Will Duckhenfield Primary be reopened in January? Okay, that was not on the list. We don't know yet. We don't know yet. I'm being told we don't have that information just yet. The Jota bus owners charging an arm and leg for transportation. It's a statement, not a question. Okay, yes.
So if I may say, ministers, the ministry will be negotiating special rates for the transportation. As we have indicated, we have the budget to do about 7,500 students per year. So our team at Central Ministry, we do the negotiation. We try to get the best rate that is possible, and then we provide the information to the schools accordingly. So we do understand, but we believe that there is some extra capacity that these bus contractors do have at this time, and I believe that half a loaf is better than no loaf at all. So we'll use our negotiating skills, and we will try to get the best rate to accommodate as many of our students as possible. And as Jamaicans, we want to make sure that we have an educated society, and so we will work in partnership with the bus contractors to ensure that our students can be transported at a good price and safely.
Thank you. Why are there no considerations, Dr. Kasan, Troupe, made for students in Pathway 3 who did the diagnostic test?
That is not totally accurate. We have made consideration for all our students. And as I've said earlier, how the diagnostic test was designed was the questions that were placed on the instrument and the answers and the distractors that were placed and were deliberately placed based on a psychometric instrument that we used. So for every answer that was selected, it told us whether the child had basic knowledge, no knowledge, average knowledge with limited application, and full understanding with full application. So it was clinical and specific. Now that information also will guide us as to who will be on a particular pathway in our secondary schools. So we don't necessarily use pathway to define our students at the primary school. We talk about their learning program, and we talk about the levels of understanding that we are seeing in the materials that they will deliver and their profile. So we use the levels of understanding to design the intervention. Now that same kind of information will help us at the high school level to decide the pathways that the children are performing on. Out of the PEP, the students are also placed on a pathway, and those students are supported. Now in the high school, for our parents who may not be aware, we have put coaches in these high schools. These coaches were engaged to work specifically with Pathway 3 children. We also supported the high schools with additional staff for math and language to make sure that these students are addressed in smaller groups, and that's also the pathway support. We also gave technological devices to work with these students, so the coaches were given tablets from before COVID to work with these students, and those instruments are available. We now have the added value of the app that the ministry developed, and on the app, we have materials aligned to the different performance level, the profile of our students. So every level of student is being supported. When we modify the curriculum, that also went into the design of the curriculum. What material should be leveled at a pathway 1, 2, or 3? And in the training that we just concluded with our teachers for the common planning time, the teachers were also supported in how to design those learning instruments and programs for the students on the different pathways. So we are catering to all levels. This is the philosophy of our curriculum. We understand that children are different, and we have set up the curriculum and the learning programs to make sure we cater to all levels of differences in the system.
Thank you, Dr. Troupe. And just to say that the National Parenting Support Commission has also been working very closely with the curriculum unit. And we have had training with parents up to 2 weeks ago on the very issue that was just being discussed. We're trying to get parents to understand what the provisions are, how the curriculum has been modified, what this learning kit is, how to access Google Suite. So we have been doing quite a bit of work with the curriculum unit. There is support for all our children. And of course, the regional special needs coordinators too, Dr. Troupe, who are also in the system, a part of our system to give that kind of support. And those parents who were trained 2 weeks ago, they're also giving the information that they learned. They're also sharing the information, I beg your pardon, that they learned with other parents. So there is much support. Thank you for that question. How do we get students with their own tablets? How do students with their own tablets get information, or the information let me get it together. How do students who have their own tablets get the information or materials that have been placed on the devices for those students on path?
Okay. It's on right hand. Okay, for those students who have their own devices, we were asked this question as we prepared Dr. McLean for back to school, and we had to go back to the drawing board to speak to our developer for our MOE e-resource app. And we were able to quickly get that app into the App Store. So you don't necessarily have to send your devices to the Ministry of Education to access the app. You can go, any student in Jamaica or anywhere can go into the Google App Store and locate the MOE app. It's called MOE e-resource app, a nice blue, red, and yellow picture. You will find it there. You can just touch that, and you can download. And once you download it, you can access it offline. You don't need internet after you have downloaded that. So you can go to your school, access the internet at your school to download that app. And once you go home or anywhere else, you can navigate that app without any need for internet. So any Jamaican child can access that resource.
Okay, will the list of schools that will return to face-to-face instruction be published?
Absolutely. We've made public the names of all the schools that are currently operating the face-to-face. And we will also, of course, make public the list that we are targeting for January 4th opening as well.
Okay, and I'm sure there will be supported bulletins and so on. So please stay tuned. Please remember, we have 36 helplines out there. Some of you have been calling. Yesterday was quite a day for us. We kept answering the phones. So remember, we have 36 helplines out there for parents as well. So please feel free to access those helplines so we know where to pass on your questions and how to answer some of the concerns based on what you would have communicated to us. Okay, what will happen to the young children whose parents are teachers and have absolutely no one to monitor them online? Well, that sounds like my question. What will happen to young children whose parents are teachers and have, okay, so yes, we're very conscious that teachers are parents too. And while you're busy teaching and monitoring other students, sometimes your own children are not supervised. May I just call on the community, which is what we've been saying, that COVID is teaching us that it really takes community effort. So for those situations where you have someone in the community who you trust, and I'm not using that term loosely, or if you can have your classes in the same space where your children are, and while they're doing work, your children are doing work, while you're teaching, your children are doing their work, so that you at least you're in the same space, that would be advisable. But we're very concerned too that we do have teachers who are parents too, and they're going through COVID just the same way. Teachers, you can also access the helplines for further information. I sometimes don't want to give these blanket solutions because sometimes you have unique situations. So please access the helplines or call the Commission directly at 967-7977, and we will hear what your specific concerns are and what your unique situations are, and we'll come up with solutions together. Okay, and we're winding down. Would you believe that we only have 6 minutes to go? My goodness, where did the time go? We started just about 6:35, and it is now 7:30, so we have 5 minutes to go. And will any high schools in Kingston be opened?
Go ahead.
Right, so go ahead, Dr. Troupe.
Yeah.
Okay. Again, as Minister would have said, the schools that are selected for opening is guided by the risk ranking approach that we are using and the approval of the Ministry of Health. We have had one such school in Kingston that has been approved. That's Camperdown High School, and they began their operations today. And so that's the only high school in Kingston at this point in time. There are, however, other schools in St. Andrew, because you know Region 1 is Kingston and St. Andrew, that would have gotten the preliminary approval, and we are working with those for the January startup. But as Minister said, we will be publishing the list of those that are open now and those that we are preparing for January.
And finally, before I wrap up, how do we get the access code needed to access materials on the app?
Well, it's open. Parents, the app is open. So we would have sent out to our schools already the guidelines to access the app, and it therefore means access the e-resource app. It's open for all our children. And then once you enter that, then you will see the different grade level materials that are packaged for you, and you can enter and navigate and experience those materials. But there's no code at this point in time. We have removed that.
And maybe we can squeeze this one in. Some schools were given additional teachers in preparation for face-to-face.
Back into the environment. So once a school is approved for opening with all the variables considered that we explained earlier, then those students will be given priority.
Thank you. I'm actually squeezing in this one. I'll wrap up though, and I'll meet the deadline. Concerning the students who are way below their reading levels, will the diagnostic test be a true evaluation to determine position of each student? Truth be told, some of them,
So the diagnostic test case here was not designed to tell us about position, or it was designed to tell us what the student knows. Each answer, as I said, and I want our parents to understand. So if it is that you had your hesitations and you did not send your child in small groups to do, or you didn't allow them to do it online, I am asking and encouraging you to have the children experience this exercise. It is what it is, a diagnosis. It's not a pass or fail exam. It's not anything that we're going to use to determine who's better or so. It is to tell the teacher how to best respond to your child's needs. Each answer that the child selects for every question, it tells the teacher the level of understanding for the concept that is being measured. And that is very, very important, because the foundation knowledge, parents, is important for us to build on that as is expected as they move up in the system. So parents, this is not a pass or fail. This is to diagnose, to find the problem, and to help us so we can treat with it in the most appropriate way for your child.
final words, Mrs. Gage-Grey, very briefly.
Thank you. We just want to say to our parents that we have to be extremely vigilant at this time with our children. The care and protection of our children is very critical, and we want you to do your best to take care of them. And if it is that you need support, you can make contact with us. We have offices in all 14 parishes, and if you suspect that a child is being abused, then you need to make that report to us at 888-PROTECT, and we will respond.
Thank you. Dr. Troupe?
My appeal, Kaysia, is to my parents. Parents, if this is going to work, we need you now more than ever. We would have started the pilot, and in our deliberation with our parents and our principal, rather, they would have said to us that some of our parents were still not ready to have the students back into the face-to-face engagement. I want us to be ready, parents, even if your school is not on the list that we're going to be published in now. I'm asking our parents, get ready. We need you to prepare the students for the learning environment. I'm encouraging our parents to help the boys and girls to do hours of work. It's a concept that is utilized across the world for students in and out of school. As a mother, you know that at least 2 hours of work should be good to reinforce what is happening in the learning program for your child. Put that in place, even if you can't understand the concept. partner with persons in your home, in your community, and help your children to get into that attitude of doing hours of work so we can benefit from this time of independent learning. We have to shift into that gear so our boys and girls can capitalize on this time. We need you parents. We have tried, we are still trying, we are listening, but today I am making an appeal for our parents to do their endeavor best to support what we have in the field for our boys and girls.
Thank you, CEO. Our PS?
Okay, so I just want to say to our parents that the Ministry of Education, Youth and Information is really here to serve you. We are the servants. You are our most important customers. We want to make sure that we provide quality education for your children. I also want you to be encouraged. In every crisis, there are opportunities. We have seen some real opportunities in this crisis. For example, we already know that some of our students were not moving along the performance scale as we would have wanted to. The technology has provided us with that opportunity that even after COVID is no longer with us, and of course we are quite optimistic, we still will be able to utilize the technology to ensure that we can make up for the learning loss. So it is a crisis, but I really see a bright future within the education system, as I believe this will allow for us to be able to meet the needs of our students at the level that they're at, and to take them at each grade level to where they need to be as they advance into the education system. And so I believe there is a bright future for this country, and I just implore you, just work with us, continue to encourage your children, and we know with God's help that collectively we are going to make it together.
Thank you, PS. Minister Morgan?
The most important thing, I think, is for us to focus on two things. One is the welfare of our children, primarily, and the welfare of ourselves. Our children are depending on us to work together to ensure that they can see their teachers and friends live and in living color next year. And I think for our own safety, we have to recognize the importance of the protocols as established. It's for our own good. They are not oppressive. They're about ensuring that we can recover next year in a bigger and better way. So the one message I want to leave with the public is to follow the protocols, protect yourselves, look out for the children, so we can start fresh next year, bigger and better.
Thank you. Minister Williams?
Yes. I want to say how very delighted I am to have had the opportunity to have this conversation with our parents and guardians. I know that all of your questions have not been answered, and so we are committed to have other similar forum, to continue to have the dialogue with you, to understand what your fears and hopes and dreams are about your children, so that the ministry can be there to assist, to enable your children. We implore you to continue to be the advocate for your child, to continue to interact with the child, enforce the good principles that they would have learned in school. All the research that I have looked at says that when parents are engaged with their children get better grades. And that should be a motivation for all parents across Jamaica to really engage with their children. We're here to serve you at the ministry. We wake up every day with the children of Jamaica on our minds, and to see how best we can help them through the pandemic and beyond. We have great hopes and dreams for our children, and we know that they will not disappoint, that we just need to be able to point them in the right direction. So parents, guardians, thank you for being on this session today, and I look forward to other similar conversations with you.
Thank you, Minister. Ladies and gentlemen, we've been here for just about an hour and a half. You've heard from both ministers. You've heard from the Chief Education Officer, certainly the Permanent Secretary. You've heard from Mrs. Gage-Grey. And you've heard from me, Kaysia, Kerr, CEO of the National Parenting Support Commission. You know, we've had several of these fora. And like Minister just said, we will continue the conversation. It doesn't end here. Certainly for those persons whose questions were not answered this evening, we will ensure that we answer them via the social media pages. And I want to also reiterate that there are 36 helplines out there. Please call the helplines so that we can answer your questions. We can get help for you, because we're also a coordinating agency. Where we don't have the answers, we certainly know where to find them. So I want to encourage you to remain safe. Let's think about the safety of our children, and let us continue on positively in this business of education. You're important stakeholders. That's why we're here. Thank you so much for having joined us. Good evening, and God bless you. God bless Jamaica.
Is what you've been waiting for. A chance to change your point of view and take the break you deserve.